Welcome back to the Nursing Post podcast, All Nursing All the Time with Ashley and Rosa. In today's episode, we discuss ADHD, which is Attention Deficit Hyperactivity Disorder. Our goal is always to spark conversation and to inform.
I think most of us probably know somebody that has been diagnosed with ADHD or is in kind of close contact with somebody that knows somebody with ADHD. With that, the term is very familiar, but just because people throw around the term ADHD doesn't mean they actually know what it is. So today we're going to be just kind of diving into what those signs and symptoms are, what the treatments are for ADHD, so you can spot it and understand it a little bit better than before the episode today.
So here are some numbers, because we always love numbers, the statistics and the facts. We always love them. There's an estimated 8.4% of children that have ADHD and 2.5% of adults that have it. ADHD is more prevalent in males than females, but females are also diagnosed. ADHD increased by 42% between 2003 and 2011. 42%, by the way, is a lot. That's like almost half. So I'm just throwing that as a side note out there. So the median age of onset for children that are diagnosed with ADHD is currently 6 years of age. Approximately 1/3 of children diagnosed retain the diagnosis into adulthood. The overall prevalence of ADHD in an adult is 4.4%. Non-Hispanic white groups had a higher prevalence than all other races and ethnicities. An estimated lifetime prevalence of ADHD in U.S. adults aged 18 to 44 was 8.1%. And about half of the patients diagnosed have a parent or another close relative that are diagnosed with ADHD.
Now, curiosity kills the cat, wanted to do some research after seeing the numbers of the increase of 42% from 2003 to 2011. So my thing is what happened during those years? And we know that social media started taking off, the internet became much more popular. And I graduated from high school in 2004. And we had like AOL instant messaging, which some people are probably like, what is that? You had the internet, you could download songs, but that was all on dial-up, which is something that my children would be like, what is this? Like the internet's broke. They would think that it's not working because it's so slow.
Some people don't know what CDs are, honey. So I get it.
And so I was like, okay, is the increase with screen time and social media causing a direct effect on ADHD? And I kind of went in with the assumption of, yeah, probably is. But the research was really kind of mixed. I was able to find numerous articles going both ways. One saying, yeah, there was an increase, but not really statistically significant. And then other ones saying, oh, there's been a significant increase in ADHD because of this. Now, they're actively researching all of this now, but it's interesting to see that just in the last couple of years, how the data is not skewed to one side. It is very much still up in the air of how much this really affects children. Even in the last couple of years, with there being a larger diagnosis, and I think the pandemic probably has not helped anything, especially with kids. They've just been thrown out of their routine. But there was a study that was done just in the last couple of years that said there was a significant increase in symptoms of ADHD, but not only ADHD, but other mental illnesses, anxiety, depression, and ODD, which is oppositional defiance disorder. So I found it interesting that we're seeing an increase in all these things. I'm just curious as to what the newer research is going to bring out in the next couple of years regarding ADHD and social media influence and screen time, like gaming and things like that?
I think the last 2 years of the pandemic is going to bring a lot. I actually saw on the news this morning a study saying that children, since the pandemic has happened, that children have more anxiety and depression than before the pandemic happened. And, I totally agree with that. I can only imagine having ADHD or any other type of learning disability and then needing, in-person instruction and then having to do everything, online with videos or modules instead of like in-person type of
Hands-on.
instruction. Yeah,
Mhm.
I would have been thrown for a loop for sure.
Yeah.
So I
But
can
yeah.
only imagine what it's like for children. So what is ADHD exactly? Like everybody has heard of the term. I think, attention deficit hyperactivity disorder is pretty much self-explanatory, but it is one of the most common mental disorders among children, and it does affect adults too. So basically, it's the inability to keep or maintain focus with excessive movements that are not fitting to a setting and making quick decisions in the moment without thinking about the consequences that follow. There are factors that contribute to ADHD. Some say it's genetics. Some say it's environmental. It's like that whole nature nurture thing. It always comes back to nature and nurture, or
You can't get rid
it's
of it.
crazy to me. No, you
Yep.
can't. It's always in something. If it's not
Yep.
that, it's the dollar bill. I tell you, it's like,
Yep.
it's always there. Studies have shown that mothers who smoked cigarettes and or used alcohol during pregnancy have children with ADHD. So there's a correlation there. There's a higher rate of diagnosis. Low birth weight, brain injuries in utero are another contributing factor. And then, of course, environmental factors. I know back in the day, lead was a big thing.
Yeah.
And unfortunately, lead does damage children's developing brains. And so they're attributing lead also as like a risk factor to ADHD.
Now, when you're looking at trying to get a diagnosis of ADHD, there are certain criteria that has to be met, and that criteria comes from the DSM-5, and there has to be 6 symptoms of inattention and hyperactivity to be met. So they break those two apart.
Total of 12 basically from these two lists alone. You have to have like 12
Yes.
of these signs or symptoms.
And
In
not only do you
addition,
have, yes, so you have to have 12 signs and symptoms before the age of 12.
Correct.
For the attention side, you're looking at children that fail to be able to give close attention to detail. So you'll see this in careless mistakes in schoolwork and other little things at home, trouble holding attention on a task or playing. They're not able to, or they don't seem to listen even though you're directly speaking to them. They don't follow through with instruction, or they fail to finish their schoolwork or chores. They have trouble organizing tasks and activities. They avoid or just don't do work that requires a lot of mental effort. There's a lot of pushback from that. They lose things. I mean, I need more pencils. I can't find my eraser. I don't know where my highlighter is. I've left my book somewhere, all those things, even toys. They are distracted easily, and they are forgetful. And that's a list. And I'll be honest, I read that and it hits home a little.
Doesn't it? Forgetful, easily distracted. Those for me are like the big two. But how I feel, like I've told you like 1,000 times over, I feel like everybody in this point and in this era will have a little bit of ADHD. I think,
Yeah.
I think society has kind of made us that way
Right.
with our phones, with the internet, just even watching the news. You can't even watch the news in peace without that stupid scroll kiosk on the bottom. Drives me bonkers. I'm like, should
Yeah.
I be listening to the anchor or should I be reading what the kiosk says?
Right.
And so like, I think everybody is going to have a little bit of ADHD. They're going to get sidetracked. They'll be like, squirrel, and
What
then
is
they'll
that?
come back.
Yep. So for the hyperactivity part, that's a little different. Now remember, you need 6 from the inattentive and 6 from the hyperactivity. So these are children that will fidget, and this, that can be just as simple as them squirming in their seat or constantly tapping or moving or doing something. They get up a lot of the times in situations where they should stay in their chairs. They run around, climb limbs, do things at inappropriate times. They are unable to play or take part in leisure activities quietly. They are very on the go all the time. Rosa has said, if I could just bottle up that energy and sell it,
I'd be rich, for real.
Children often talk excessively, or they blurt out answers even before the question is even out completely. They don't really want to wait their turn, and they interrupt others.
Once again, I fidget a lot.
Like I said, it does. Some of these you kind of hit home and you're like, well, but I don't have 6, so I guess I'm okay.
Yeah. What is that for me? 3? Okay. On top of that, you also have to have these symptoms present in 2 or more settings. So if you're a child, you have to be this way, like at home and at school. If you're an adult, you're like this at home or at work or at church or something like that. There has to be clear evidence that the symptoms interfere with or reduce the quality of your social interactions, school, or your work functioning. And then everything else that's mentally related has to be ruled out as a disorder. So you have to rule out depression, you have to rule out anxiety, bipolar, etc., so that the only thing left is the diagnosis of ADHD.
Yep. I know Rosa talked a little bit about adults being diagnosed with ADHD, and it is a little bit different because there's no specific test that an adult can take to be diagnosed with ADHD. It's pretty much accumulation of a childhood history mixed with adult symptoms. The biggest takeaway is that you cannot be diagnosed with ADHD as an adult if you don't have a history of that inattentiveness and hyperactivity. That is a prerequisite to the diagnosis of ADHD as an adult. Now, there is an exception because there's always an exception in medicine. There are people that suffer from some sort of like traumatic brain injury of some sort, and those patients can, in turn, end up with ADHD. I was talking to another nurse the other day who actually knew another nurse who fell on ice at work and hit her head so hard, like she bounced backwards and hit her head on the other side, and now has post-concussive ADHD, which I didn't even know was a thing.
I didn't either, but it makes sense. Your brain is so fragile. People, I don't think, realize how fragile it is. And it is a muscle, but not in the type of muscle that you would probably find anywhere else in your body.
Right.
So you can just imagine that when she hit her head going back, her brain went forward, and when she went forward, you know what I mean? Her brain went back. Yeah. So I can kind of see that in my mind. But I'm a nurse, so
yeah.
It makes a big difference.
I couldn't imagine, because she was older in age, so she's in her 50s, which is not old, but to develop something like ADHD in your 50s with not having any previous problems with being able to hold attention or not being able to sit still, I could only imagine how that could, or how that is disrupting her life.
Oh yeah, I can. It's like frustration times 100.
Yeah.
She went half of her life with no issues, and now for the rest of it, she's going to have issues,
Yep, exactly. So I think it does make it a little bit hard. But as an adult, like I said, you do have to have those childhood symptoms, but there's a couple other, it very much mirrors the child's, signs and symptoms. But adults also have a hard time staying on task. They have varied attention to detail. They do have a hard time with organization and prioritizing things, still have the difficulty with tasks that require like sustained mental effort. They seem to have a chaotic lifestyle. They can be very impulsive or become easily frustrated. A lot of them have other mental health comorbidities, and some even have trouble with substance abuse as a means of a coping mechanism. A lot of these have developed from coping mechanisms from years of undiagnosed ADHD and without having the proper treatments.
Correct. So there are and is treatment for ADHD. The most common one is medication, and the most common medication is a stimulant. You're talking about your Ritalin, your Vyvanse, Adderall, Strateras. That's what we're talking about when we're talking about stimulants. And they work by increasing the brain chemicals dopamine and norepinephrine, which play essential roles in thinking and attention. So you can just, like, the analogy I kind of use is that hamster in the wheel. Yeah. It's like going really, really fast and isn't getting anywhere. And like, that's how that child's brain is thinking, or that adult's brain is thinking. It's like, 1 minute, I have to finish this math problem. Oh, I forgot to put my clothes in the laundry basket. Oh, I need to talk to my friend when I get home. Oh, that video game from last night, I think I like that. I'm going to go ahead and play it again today. Squirrel. Okay, I need to finish this math problem.
Right.
So what the medicine
none
does,
of it got done.
No, none of it. And they can't even remember what the first thing was that they were, thinking about. So that makes it even worse. So what the medication does, it just kind of slows that thought process down, and just enough, because there's different doses, and everybody's not cookie cutter. So you might try one to start and find out that might not be the one, but there's short acting and there's long acting and there's different doses. So the whole point is for it to balance chemically your mindset, because anything that's a mental disorder usually is a chemical imbalance. So we need to keep that in mind. The other forms of non-stimulant medications, we're talking about antidepressants, really, things like that, in addition to a stimulant. There are therapies that are used: cognitive behavioral therapy, family therapy, support groups, and self-management. And as a parent and student, you do have the right to obtain accommodations in school. Yeah. So there are educational programs and assistance programs through school. And on a personal note, to put out there to the world, even if you don't think your child has ADHD, maybe you think they have dyslexia, or maybe you think they have an auditory disorder or a speech impediment, anything, at any time, you have the right to go to the homeroom teacher and or the principal and ask them to test your child to make sure they do or do not have any of these learning disabilities.
Yes.
My personal experience, it's best to do it in email, so that way you have a physical copy and they have a physical copy, because I can tell you with my experience, it was, oh, we don't think he needs that. He doesn't have all D's and F's. So just for safety, like, make that request in writing. The school has a certain amount of time frame in which they have to get the ball started and rolling to have the testing done. And what they'll come up with is either the child has no learning disability, or they do, and they will have to have special management interventions or academic accommodations. So accommodations is like a 504 plan or an individual education plan for interventions and further accommodations. So even your workplace, because this is considered like a disability, and your workplace would have to make certain accommodations for you as well. So even as an adult, this helps you. The thing is if you suspect that your child has ADHD, it's extremely important that you have your child tested, because those accommodations are probably lifelong. And even though it's elementary, you have to start thinking about middle school, high school, and college. And people that have ADHD actually receive more time on testing, including the SATs.
It does make a big difference. And just because those accommodations need to be made does not mean that a person with ADHD can't live a full, productive, and successful life.
Yeah, absolutely.
With anything, the faster you get diagnosed, the better the outcomes are going to be. ADHD is no different. As soon as you can get diagnosed, the better, because you can start on therapies and learn to live with ADHD and how to get the most out of your therapy. So those wellness appointments are very important to have with your providers to make sure that either you're following up on your kid, or even as an adult, that you're not missing something. Because a lot of adults they're not diagnosed as a kid, and they're having to try to work through that now. And the CDC did recently update their developmental milestones for children for the first time in like 20 years. So
that's a big deal.
Yeah, it is. It's huge. So now the checklist will inquire about milestones 75% or more of children can be expected to achieve at any given age, eliminating any kind of confusion and alarm, but still ensuring that children who need additional help and resources are identified.
Because the old milestones and guidelines, they were kind of like a sliding scale. You know what I mean? They were like, oh, your child's 4 months, but they're still kind of in the 2 with this, but in the 6 with this. Where the new guidelines are pretty definitive. They're like, by the age of 6 months, these are the things that your child should be doing. Right. And if they're not doing this, here are some resources for you to evaluate your child to make sure that there is not any developmental delays.
Right. And if they're not achieving what 75% of other children are achieving, that's a problem.
It is.
And that, I think, will set more kids up for success.
I agree. For our show notes and our resources, visit our website, the nursingpostpodcast.com. Find our merchandise there as well. Subscribe to our podcast on your favorite platform. Please share your thoughts and your comments. Thanks again for listening to the Nursing Post.